Hello, I'm Shannon Jones, and I wanted to come on here and talk about policy recommendations for healthcare literacy for patients and families. And when we talk about policy recommendations, one of the recommendations that we came across was to advocate for healthcare policies supporting health literacy education. We need to have national health literacy frameworks. We need to make sure that to develop, maintain, and mandate training for healthcare workers such as doctors, social workers, case managers. The training should include digital health literacy as part of the medical education. Why should we have digital health literacy? Well, let's say it increases preventive behaviors such as vaccination and infection control. And it also helps healthcare workers access and apply accurate information, improving patient care. And then the benefits of advocating healthcare policies supporting health literacy education would be number one, healthcare workers are better equipped to engage with the patients. And then second one, it reduces the spread of misinformation. Policy recommendation number two, incentivize healthcare organizations to implement literacy programs. What are some of these incentives? Governmental grants, tax credits, reimbursements to organizations meeting health literacy standards. What's the impact on organization? It encourages investment in literacy programs, leading to improved patient outcomes. And it also reduces infection rates and enhances patient engagement. Evidence shows that organizations that prioritize literacy see reduced healthcare disparities. Another policy recommendation, standardized health literacy assessments. Let's have routine assessments. Mandate the use of standardized health literacy tools for both patients and healthcare staff. Assessments should be part of routine visits or performance evaluations for staff. What's the purpose of these assessments? Well, it's going to identify these gaps in knowledge for tailored interventions. It's going to ensure healthcare workers have the necessary skills to combat misinformation and provide quality care. Some example tools: digital health literacy questionnaires for providers. Let's get those questionnaires out to them. Let's get some feedback. Patient assessments to identify those at risk of misunderstanding healthcare instructions. The patients, we need to have feedback from the patients as well. And policy recommendation number four, let's focus on older adults and marginalized groups. Okay, let's targeted health literacy education. Let's get these people educated on healthcare. Let's prioritize health literacy initiatives for older adults, especially in the rural areas. Educate about Medicare, Medicaid, and healthcare policies to reduce systemic barriers. What are the challenges that are faced by these marginalized groups? Well, lack of access to healthcare literacy groups, and systemic marginalization, lack of policy knowledge, and health disparities. Some of these tailored programs need to have culturally competent programs that consider place-based drivers of health disparities. Policy recommendation number five, implement health literacy programs to overcome systemic barriers. Okay, accessible and culturally relevant programs. Let's have those. Design these programs that address specific challenges faced by older adults and marginalized communities, such as language barriers, technology access. Incentivizing organizations. Let's get these healthcare organizations incentives for the providers to create inclusive programs. These programs would help reduce disparities and improve healthcare outcomes for underserved groups. Examples: programs that target older women in rural areas to improve their understanding for Medicare and Medicaid. All right, we'll move on to policy recommendation number six. Let's also encourage standardized assessments for older adults. Let's see what these older adults, our parents, our grandparents, what do they have to say? So, routine health literacy assessments for older adults. It will integrate health literacy assessments into regular visits with older patients. What's the goal? Identify at-risk individuals and offer personalized educational resources to reduce medical care and avoidance. Studies show that higher health literacy in older adults leads to better healthcare engagement and fewer missed medical appointments, which is very, very important for our older population. So let's summarize these recommendations. Let's advocate for health literacy education for healthcare workers. Let's incentivize organizations to implement literacy programs. Let's mandate standardized assessments for both staffs and patients. Let's also focus on marginalized groups, particularly older adults, in policy development. What are the long-term impacts? Let's reduce health disparities, improving healthcare outcomes, and empowering patients to make informed decisions. Policymakers need to prioritize health literacy to create a more equitable healthcare system. As we conclude our webinar on healthcare literacy, we all just want to thank you for taking the time to watching our videos, and I hope that you guys gain the knowledge of how important healthcare literacy within the patients and their families is so important to have. Thank you.